All right. We are talking infant and child chiropractic today, and I am so excited to have on Dr. Stein here sitting before me. It is so good to meet you. I feel like we should have crossed paths by now because you happen to be here locally right near me, and we know a lot of the same people, but yet we have not. So, this is our time to chat and meet and dive into all sorts of good information for moms out there that are pregnant and going to have a newborn, or even moms that have children right now, and help them learn about all the benefits of chiropractic. So I am just overjoyed that you are here today. So thanks for being here.
Yeah, thanks so much for having me. I'm excited about this.
So I want to hear first from you what inspired you to specialize in correct me if I'm wrong, there's chiropractic care that you go through training with. And then I don't know if there's like in addition to with the pediatric and the infant chiropractic or any special certifications and whatnot, but clearly you help infants and pediatrics. So just share more about why you decided to expand more into that side of things.
Oh, yeah, for sure. So, real quick on that whole pediatric specialty thing, all chiropractors are licensed, at least in the state in California, all chiropractors are licensed and capable of seeing kids. That doesn't mean they all should. Obviously, we specialize in pediatrics, and we think that because with every age and every milestone and every developmental trajectory, there's different nuances that come along with the care of each age and each step or phase.
Mm-hmm.
So we think that the practitioner that you see, the chiropractor you see, probably should be really well versed in those things. For me personally, um, I went to chiropractic school thinking I was going to have a family practice. Kind of thought I was going to see a lot of athletes. Hope to see maybe some younger athletes. Um, and going through school, really kind of wanting to dive more into what's this pediatric thing, what's this look like, what might we be able to do to help that population. And then we had a situation of our own with our son Luke, which I think
Mm,
is pretty common. People's paths change. I mean, the way that we live our lives is we believe that we make our plans and God directs our steps. And we
yes.
had certain plans, and um, we took a detour, which was a long, bumpy detour. And we had some issues with our son, Luke, who had some sensory processing issues. Um, he was nonverbal, just a whole
Mm,
bunch of things.
yeah.
And we were just so fortunate and blessed to get connected with some who are some of my greatest mentors today still, that were really heavy into the pediatric place. We traveled all over the world to see, or not world, all over the really state and country to see some of these specialists and talk to some of these specialists in the pediatric chiropractic world that
Wow.
really kind of took me and Sandy, my wife, under their arms and just said, "Hey, we're going to walk this process with you, and we're going to teach you along the way how to help your own son."
So you were already a chiropractor, and then you went into this, you got this training?
Yeah, so I was 2 years into practice, um, about when we went this direction. I had just graduated, just opened my practice when Luke was teeny tiny, um,
Gotcha.
and then by the time he was 18 months, we realized like he's not really talking a whole lot. Um, we didn't really get a whole lot of answers that we were looking for. We got a little bit of the runaround, and so we just thought, we function. Even though I am a doctor and even though I specialize in pediatrics, if I'm going to be really honest, it's Sandy's mama gut that makes the decisions for our
Yep.
healthcare house.
Yep.
And when she said, "Hey, something ain't right," well, then something wasn't right, and we moved forward with that.
Mm. Um, okay, there's child chiropractic, and
Yeah.
then is infancy, like when you see infants just after they're born, is that, I mean, certainly that's like a whole different level to training, right? Or is that really go hand in hand with infancy and seeing children? I mean, what's the difference?
Yeah. So part of the education that I did beyond chiropractic school in some of the postgraduate work, was certification through the ICPA, the International Chiropractic Pediatric Association, which has, I don't know how many modules there are now, but a whole bunch of modules that look kind of at each approach to each different stage, different approaches or protocols to different conditions. And so that was part of the training that I had gone through. And I think it makes you pretty well versed. I mean, it's a very good tool to get you really familiar with seeing kids. And then it kind of just really boils down to putting in more work too. I'm an analytic by nature,
Mm-hmm.
so I can't not just keep studying and learning, because I turn into a toddler and I'm just like, why, but why, but why? And that's really my clinical approach too. People bring
Yeah.
concerns and it's just, well, why is that there? But why is that there? Why is that going on? And so the ICPA trains you in infant care, in pregnancy, in standard pediatric care. And then a lot of the stuff that I've done beyond that is really specifically toward traumatic brain injury. We see a lot of those cases.
Mm-hmm.
Birth trauma is probably one of the more common things that we see. And that could be anywhere from severe to subtle.
Mm. Yeah, that's when I actually became aware of how chiropractic could help infants. It really blew my mind. One of my first births as a doula, I watched a baby, I should say, I watched the doctor essentially pull and twist the baby's head. It was a rather large baby and, having a little problem being born there. And he just twisted the head in a way that I just knew was not right. Even though I had literally never witnessed a birth before, I'm like, that is not right. And sure enough, that baby ended up having acid reflux. And I was so brand new, I didn't want to like jump the gun and say anything to the mom. So, but unfortunately, then I ended up getting to her a little late because she had already seen the pediatrician and started him on medication. And that's when I said, oh, I meant to tell you this sooner. So, I hope you're okay with me sharing this. But and then I kind of went into what I saw at the birth and how maybe she should explore chiropractic. And so sure enough, she took her baby down to a local chiropractor and was able to basically wean off the meds pretty quickly and literally fix his acid reflux
Awesome.
from, not many weeks after. And I remember her saying the chiropractor validated, yeah, like his neck was really kind of jacked up. So I'm glad to kind of jump into that because that's so true, as I have seen that firsthand. And but just to be clear, I want to make sure I'm understanding this right. So not every chiropractor is certified to handle infants, or they are, but not all should be. Like I'm trying to figure out, do they teach you infants, children, and adults?
In chiropractic school, yes, as
Okay.
well. ICPA is specifically for pediatrics. So
Okay.
all chiropractic schools have pediatric courses. It's basically common childhood illnesses, so that you can recognize them if they come into your office. I mean, we're portal of entry. We're primary care physicians in the state of California, at least. And so, if a kid were to come in with with various conditions, we're on the hook to make the diagnosis or make a referral or make a protocol to be able to care for them. And
Mm-hmm.
so, with that, um, yeah, so there are courses, but they're courses that really kind of give you an introductory of like, here's kids and here's what you might see, but it doesn't give a whole lot of information. Fun fact, I don't know if you knew this, but I actually led that course at the chiropractic school for about 5 years and kind of oversaw the pediatric department there.
Oh, that's awesome.
And so, but it's in that course, one of the things that I would say is, hey, here's kids, we're going to give you some understandings on what to do, but if you really want to see kids, you need advanced training. So do.
Okay, that's what I wanted to hear in here, kind of that difference, because I know some chiropractors see children and essentially have that extra education to do so, like you said. So that's important, is basically what I wanted to make sure that the listeners heard.
Yeah, I actually started seeing a chiro when I was 11, and he wasn't a pediatric based chiro. um,
Mm.
so and he was awesome.
Okay, so let's jump into now the real details that everyone wants to know. How does chiropractic care benefit children or infants? I know it feels like two completely different developmental stages in life. A newborn baby and the pressure and the things that you do to a newborn versus a child are very different. But in generally speaking, like how can chiropractic benefit children?
Yeah, so I think I'd back up on that and say it benefits kids really the way it benefits everyone. And it starts with the understanding of chiropractic as a whole. Chiropractic means effective treatment by hand. And
Mm,
while most people think like chiropractors really focus on neck and back pain, what I say all the time is the neck and the neck or spine specifically are gateways into so much more neurophysiology. That it's really an instrument by which we can influence so much more of growth and development, um, coordinated movement patterns. And so with that said, the body is made in such a way as it should be self-healing and self-regulating. Now,
right.
I'll back up and say we live in a little bit of a broken and jacked up world. And so we don't always heal. None of us are perfect. None of us have that capacity to have 100% health at all times. So things like birth traumas, things like high stressors weigh on our system, and sometimes it's just mechanical. Sometimes it's just this. I mean, I can't tell you the number of babies, especially in the last 3 or 4 years, that we've just seen like this, where they should be flailing around and moving because that's how they do the pruning of synapses so that their brains can actually grow and get on a better trajectory. And so the big picture of how chiropractic works is it releases tension in the spine, which can release tension in the nervous system, which then helps the body better regulate itself. So it's not really a matter even of like a kid with ear infections or a kid with traumatic brain injury or a kid with reflux and treating those conditions and doing a specific magic adjustment for this or that or the other thing. It's really finding out where there's tension, because tension in the spine is going to decrease efficiency by which the body functions as a whole. And
Mm,
we can raise the efficiency and effectiveness by how the body functions and optimize their potential, well, then they just stand a better chance of being healthy. It's like darkness is the absence of light, disease is
yeah.
the absence of health.
Yeah. Wow, that's really well said. I like how you said that and the intricacies of how it truly affects like the inner core of our health and particularly our nervous system, which is not always easy to get connected with. And chiropractic is one of those means. Um, okay, so are there any misconceptions or myths that surround pediatric chiropractic care
How
that you would like to clarify? I know eh, from being a birth doula that some people look at me with huge eyes when I say you should consider taking your newborn in to see a chiropractor, and they're like, "What? Like, no way. Are you kidding me?" So, that's definitely one of the things that you need to touch on so that people can understand, no, no, it's not like an adult. It's entirely different. So, what are some of those misconceptions?
yeah. Well, if we're going to list misconceptions or talk about some misunderstandings, I probably need to ask how much time we have.
Okay. Yeah, that's true.
There, there are, it seems relatively endless, the amount of misinformation, misconceptions, misunderstandings, and I think it really just boils down to misunderstanding. Somebody might watch a really popular YouTube video of like a strap adjustment, or one of the ones where somebody's mic'd on their lapel and it's just the loudest crack you can possibly think of, and think, well, that translates to pediatric care, right? Then that what you're going to do to a baby? And what I would say is, first and foremost, absolutely not. When it comes to especially infant care, there's no cracking, crunching, popping, clicking, snapping. None of that happens. And the reason being is, well, one, it's not necessary. um, and two, at each stage. So when a kid starts to hold their head up on their own, when they start to sit up, when they start to crawl, when they start to walk, those are happening largely governed by the development of the spine. The spine is, we're
Mm,
born in a C shape, and then we have secondary curves in our neck and in our low back that actually help us become upright. And so when it comes to making those adjustments, we want to make adjustments that are gentle and in line with those joints, also recognizing there's a lot of cartilage. There's not a whole lot of bone at that point that we're going to actually be shifting and moving. And so I think people think it's dangerous because they don't see it or don't know what it really is. I think that there's the assumption that it's a scaled down mini adult adjustment, that it's just an
Yeah.
adult adjustment on a kid. And I would venture to say that if you compare the two side to side, they don't really even look the same at all.
Mm-mm.
But
It
people don't.
doesn't even look like you're doing anything to an infant. Like it just,
It's
you can't even tell what you're doing because it doesn't look like your hand is even doing anything. It's like
well,
pressure or something, right?
it really is. And so how I explain it to parents, because I have this conversation every single day, how I explain it to parents is I just tell them, well, go ahead and just grab your shoulder, your trap right here and pinch. You're going to feel tension there because we all have tension there. And as a result of that tension, if somebody were to grab that, you're probably going to lean into that and have them push a little harder. Even if it's a little uncomfortable, your brain just recognizes, like, that's what I need. Same kind of thing happens when we go to adjust infants. A lot of times, um, we've been able to hold that pressure, excuse me, and the baby will lean into that pressure and they do the work, which is almost like cheating a little bit because I just find the right location, hold it, maybe apply a little bit of influence there, but then they really press in. And then a lot of times what we'll see is a big sigh, which is a parasympathetic response, which knows that we're really diving into the neurology. We've had babies fall asleep, or they just kind of melt.
Oh, wow. And
So,
that just shows that their little nervous system switched from sympathetic to parasympathetic and they just can finally relax. And I'm
yep.
sure that just has a domino effect, throughout their muscles and their ligaments and tissues and everything, right? And then that can affect so many things from, as I know, like constipation to nursing to fussiness and all of that. That's really, really cool. And I'm so glad you brought that up. You did a great job at explaining. I would say there's no fear any mom should have in listening to what you just said because it's really a beautiful modality when you think about it. So share some of the success stories, um, or maybe antidotes where um, chiropractic care has made a significant difference in a child's life or an infant's life. I shared obviously a couple, which I happen to know, but I'm sure you have many more and you've seen many different situations and or maybe even like conditions or health struggles reversed maybe with some kiddos. Yeah.
Yeah, let me jump back to my own son. I think that that's kind of the first big success story that we saw, and we've been,
Mm.
because of that, that launched us or springboarded us into hundreds or thousands of cases that we've been able to see. Um, 18 months, nonverbal, um, sensory issues like crazy. Spent his first birthday in his bedroom by himself pretty much because there was just too many people and his crib was his happy place. Um, and we recognized something wasn't right. Took it to the pediatrician. She said, "Well, your older one, she's really talkative, so you can't. It's apples and oranges. You can't compare the two." And we're like, "Yeah, but I mean, nothing at 18 months. That doesn't seem right."
Yeah.
Plus, he's got all these other little quirks. So we self-referred to a regional center to get him assessed and evaluated. Went through that whole process. At 2 years old, they said, "Hey, we can't give him a diagnosis of autism until he's 3 because that's the criteria.
Mm.
We're going to give you some services to do. Come back when he's 3 and we'll give you the official diagnosis." We went back at 3 and had, I think, 2, maybe 3 different evaluations. And they're like, he does, I don't know what happened, but there's no autism there. It's gone. There's
Wow.
there's no character. There's some nuances. There's some quirkiness. There's some
That's
stuff.
incredible.
Totally verbal. He still needed a little bit of speech. And I won't say that it was just chiropractic. Obviously, I'm biased, and I'm going to say that I think that was a piece of the equation. Um, but we had this team. It was almost like this shotgun approach. We had OT, speech, PT, feeding group, Chiro, and just consistency. I mean, it was staying the course for a year of just multiple visits every single day. And so that really got me at this point of like, this is doable, because we people recognized that he was on this course and people recognize that he's not now. And so my mentors who specialize in this kind of care basically like just freely offered and taught me everything they know. Probably not everything they know. I'm a little bit of a slower learner, and they still are like way smarter than I am. But they just said, hey, here's the deal. We aren't going to be in practice forever. We want to teach you this because we want you, what you're doing here, you need to do that with others. And so that was kind of the deal we made. And so then from there, we've gone on to see kids like Mateo, who was completely nonverbal. And the first time I met him, he never stopped screaming and doing this the entire time. To a month later, he's starting to say hi. To 3 months later, he's like giving me a hug and saying, "Thank you, Dr. Stein." And so we see those, and then we go to Nova, who is one of the more significant traumatic brain injury cases, and a lot of the stuff we've put on our social media, and so people can go like stalk us, troll us, whatever they want to do, and find these stories. But Nova was in a horrific sledding accident. Um, her mom, herself, and her dad were sledding down. What's that?
How old was she?
Nova was 3 when this happened.
Okay.
They hit a rock, like not a bump rock. They hit a rock because they couldn't stop in time. Mom passed away. Nova had significant brain injuries, has had multiple brain surgeries. The doctors at the hospital, Loma Linda, had said she's not going to make it. They told the dad that. She ended up making it. Then it was, she's never going to talk. She's never going to walk. She's never going to recognize anybody. And she's doing those things. She still has assistance. She still has a lot of trauma to overcome. And there's still, I believe, a lot of progress to be made. But she's doing that. She's laughing. She understands jokes. Like, it's cool to see. And I don't want to say chiropractic is this miraculous thing where I, hit the atlas, which is a chiropractic term for adjusting the first cervical vertebrae. And all of a sudden the lights came on and she was back to normal. It was, I mean, months and years of care. And it was a lot of other people in her corner cheering for her and offering services. But the thing that I see this repeated trend that when that happens with that consistency, the results are being reproduced. And when it's not being done with that consistency, the results aren't there.
Right. That makes sense. Yeah, I've had guests on that, they're speaking from their own unique perspective and their expertise in their field. And, they've said things like what you said, it takes a village, right? When it comes to treating someone in whatever health condition or whatever, circumstance, it's not just one thing that's usually going to get you better. It's the right things coming together to play their part in your body as a whole, and target that to ultimately bring things to a place of healing, right?
So yeah, and I I love chiropractic. I mean, I feel indebted to chiropractic because I feel like it gave us our son. I believe God was a piece of the equation. There was endless prayers in that.
Amen. Yeah.
But here's the other thing. As much as I love chiropractic, I love even way more just seeing kids get better, which means that if they come into my office and I'm like, hey, chiropractic's not for you right now, then it's not for you right now, because them getting better is far more important than me having a success story or me saying chiropractic did this. At the end of the day, what I tell people all the time is there's a couple of rules in our office. One, you're never allowed to apologize for crying because a lot of people cry. And if I'm honest, I probably do too, with them.
Happy cry, scared cry, what kind of cry?
All of it. I mean, because the spectrum of cases that we see are so few, it's just so vast that we're having, and there are tears of joy. I mean, in a matter of 10 minutes, it will be like sorrow to joy, just because that's just the style of practice that we have.
Right.
So you're not allowed to apologize for crying. We're a safe place. It's okay to not be okay. Um, and and then one of the others is that um, we will be always be forthright with you and tell you if we're not the right place for you, then we'll help you get to the right place. And I think that's it, kind of circling back to the misconceptions. I think that there's a thought that once you go to a chiropractor, you have to go the rest of your life. There's a lot of people that opt to go to a chiropractor the rest of their life because they see the benefits of long-term wellness care. And we have a lot of people in our office that way. But at the same time, if chiropractic's not clinically indicated, then why would I want to continue to see them? Get them where they need the most help.
I love your integrity that you have there and that you shared all that, because that's powerful and that's important. I think every office should have that foundation, and I don't know that all do, but that's awesome that you're out here sharing that. Let's talk about infants. I'd just like to touch on that as far as, gosh, I think of my son who was a C-section, and I've actually talked to chiropractors that have said they can feel the difference in a baby that was born, like, say, naturally at home with a midwife, where there was little hands-on and, just kind of guiding baby out, versus a baby that endured Pitocin for hours and hours and hours, and then maybe was born via C-section, and all the interventions that hospitals bring. Babies can come out, but not to say it's perfect at home either. I mean, birth is birth sometimes, and that's just how it is. But when it comes to infants and some of the struggles, it's hard enough having your first baby. You're trying to learn how to nurse. You're trying to get sleep. You're trying to make sure baby's fed and, you're fed. But what are some of the things that you have seen chiropractic help with a newborn? Like, how can we plant the seed in a mom's brain of, like, oh, maybe if baby is experiencing this or that, I should go take them to be evaluated by someone that is specially trained in newborns like yourself?
Yeah, so the most common cases that we see, it's not really even close, would be a side preference or torticollis, plagiocephaly. Torticollis just meaning head kind of stuck to the side. Plagiocephaly is an imbalance of the cranium, maybe a flat spot. Some people might refer to it as. Sleep issues, GI issues.
Oh, really? Sleep?
Oh yeah, sleep for sure. Because it's part of that
I
regulation.
think you just won all the new mamas over right there. They're going to the
Right.
chiropractor.
Right. And I'll throw a disclaimer out there, but not because it's a disclaimer. Well, it is a disclaimer, but because it's the truth. I still don't think chiropractic treats any of these things. I really just feel like we are helping the body function more in line with how it's supposed to. And I do think a baby should sleep. Now, is it going to be through the night? Maybe, maybe not, probably not. But should it be big chunks? Yeah, I think that's reasonable to think that. Like there's four reasons that babies cry, right? They're hungry, they're tired, they need a diaper change, or they're in pain. And if you've got those first three under control and you can't figure out why your baby's still crying, well, then there's probably a reason. And like throwing a term like colic, which is another one we see, I don't use that term. I don't like that term. Colic being defined as, crying 3 hours a day, 3 days a week for 3 weeks consecutively. The rule of threes, I don't, I don't buy it because I really think that, I mean, I think colic, and I guess you could quote me on this. I don't know how scientific it is necessarily, but I feel like colic is baby anxiety.
Hmm.
That's how we see it because it is this stress response. And if you think about it, they're triggered, they're edgy, they're restless, their stomach's upset. It's like when we're anxious, all of those things. And
Right.
so
That's a
that's
really
kind of,
good point.
if we can help pull them a little bit out of that parasympath or that sympathetic response, that fight or flight response, and help them down regulate a little bit by just physically taking tension, taking the load off of their structure, well, then they're going to be so much better off. I will say that, some of the things we say in the office are that stress is sticky and it stacks up.
Mm.
And so when you start talking about like birth trauma, some people might think, I will back up and say it's called labor for a reason, right? And you can refer to it as birth, you can refer to it as labor, but it's called labor for a reason because it's a laborious event. Like it takes work. I've witnessed it 4 times, never done it myself. Um, I got put in a headlock during one of them with my wife because it was laborious, right? Because it was a big ordeal. And the more intervention that we bring about, and by we I just mean society as a whole, the more things that we do to intervene, I believe those are more stressors on the system. Kind of looking, I mean, I have to describe this in a little bit of my worldview, is that there's a natural order of things. Like it's supposed to happen in a specific way, and it doesn't always happen that way. And intervention, thank God for interventions because they can save lives. 100% they can save lives. But everything that we do that steps outside of that natural order is going to have an abnormal consequence.
Mm-hmm.
Because if you do something abnormal, you have to expect that you reap what you sow. And it might be necessary. And so, in situations like, I would say the overwhelming majority of cases that we see with like a torticollis is a C section, which people are like, why a C section? That's weird because they're not going through the birth canal and getting kinked. Um, because I think they're not going through the birth canal and having to work it out. And
Right.
interventions or inductions specifically because baby's maybe not quite ready yet, and you have to think that their head is just being compressed with each contraction. And if they're not maybe ready and they're not in the head down position or perfectly head down position and their head's this way, well then when they're getting compressed it's doing this each time.
Mm.
For those that are listening, I was tilting my head to the side and pushing on the top of it.
Wow. Yeah, I never thought about that, especially with these doctors too. I always get so frustrated when I hear, doctors pressuring mom to have babies early or induce early because of these silly little reasons. And we're not even waiting and to allow the body to signal that baby's ready to enter the world. So, I mean, I think of just like a baby that is ready to enter the world and how these interventions can affect him or her. But then I think of all these, you know, not premature entirely, but just not babies that really aren't ready to be born quite yet. And we're just forcing them to come out, and all the, like you said, the just the obstacles and situations, and it's kind of a tragedy to think about when you think of what we're doing. I mean, I'm in my birth doula head over here just like, dang it, like there's even more layers to why I want to help moms now, in just, hearing this, go as natural as possible and stay away from those interventions, which is ultimately my goal, but that brings a whole new light to it for sure. um So, let's see. You said sleeping, digestion, and nursing, right? Like, can't a baby be like really kind of tight or bound up, and can't that like affect the jaw and their ability to open and close and suck properly or anything of that nature?
Absolutely. So the there's a lot of overlap. I will bore you, or I will not bore you with all of the neuroanatomy or neurophysiology that goes into this. But essentially, if you were to clench your jaw, and I mean, I would even encourage listeners to clench your jaw as tight as you can and put your hand on the back of your neck, you're going to feel those muscles engage. Now relax your jaw and tighten the back of your neck the best that you can and try and talk, and you're going to probably recognize that that changes the way you articulate because it tightens your jaw. If babies have, let's say, a side preference, the beginning of a torticollis, or they just have tension in their neck, they may not be able to get in the best position. We're just talking purely mechanically. If they have a kink in their neck, which is not the technical scientific word to be using here, but let's just say if they got a kink in their neck and they can't get into the right position, well, that's one, it's going to tick them off and they're going to be super frustrated. And two, they're going to figure out a way to be able to get milk from mom, even if it means sacrificing mom. So then you start seeing shallow, clicky, chompy, because babies are resilient, which is amazing and awesome. And they really don't care about the damage that they cause mom as long as they're getting their milk. And so
Right.
instead of a good solid latch and drawing the tissue in, what's going to happen is they're going to latch and unlatch, relatch, unlatch, and they're going to keep doing that because that's going to still be able to get some suction and squirt the milk out so that they can actually feed. The problem is that causes a stress response in mom for sure. That causes a stress response in baby. And every time they break the seal, air gets in. And when air gets in, it gets in the GI tract. And when air gets in the GI tract, it doesn't get absorbed. So it becomes gas or it becomes like refluxy and they spit up. I mean, the milk, the air's got to go down or it's got to come up. If it goes down, it hurts. If it comes up, it hurts. Babies are going to spit up some, but I mean, the level of or the number of kids that we see that are projectile vomiting, and I mean, quite honestly, are being told that's normal. Um, I'll just go on record and say that that's not normal. All
Mm.
some kids are like more spitty than others. We have 4 kids. They all spit a little bit different than the others. But to be holding them and hearing a splat over your shoulder on the floor, that's probably excessive. And then to have that happening like every feed, or for them to be gassy and uncomfortable, right? It goes to that fourth thing. They're not hungry anymore because they just fed. You just changed their diaper. They're sleeping okay. They're probably not tired. So there must be something else. They must be uncomfortable.
Mm. Have you seen any positive results with babies with jaundice?
Oh, that's a great question. Not directly. I haven't seen any. I have seen a lot of kids. Actually, I have a kiddo that has been under care, um, which is it's a really involved story I won't get into. But he actually has traumatic brain injury because of undiagnosed or misdiagnosed jaundice early on.
Mm.
He has seen good benefit with chiropractic care from a developmental trajectory. So dealing with some of the neurology around that, but he doesn't have jaundice anymore. We have seen lots of kiddos with jaundice. I've actually seen lots of kiddos that, on their way home from the hospital. And I mean, that conversation really is, well, they look a little orange. And so far, every parent has already known that. It hasn't been something that I've caught necessarily. And I don't know the pathways by which that might actually help. But now I'm probably not going to sleep tonight because I'm going to look it up. Thanks for
I
one.
love it. Well, I just, I wouldn't think it would have a direct correlation, but I was just wondering if maybe kind of a indirect support of some sort, possibly, you never know.
Yeah.
Is there any other advice that you would give to a parent that's listening who's considering I can't talk tonight, chiropractic care for their infant or their child?
I think, yeah, there's lots of advice I would give. I think if somebody is on the fence about it, I would just encourage them to reach out to an office and talk to the doc. Most pediatric chiropractors, I don't know all of them, but I know a lot of them. Um, I can't think of any that wouldn't love to just hop on a quick phone call just to talk to a parent without like a act now and save 50% or, none of that cheesy stuff. I mean, just, I really do think I play well with others. So I have friends that are pediatricians, like medical pediatricians. I have friends that are neurologists. I have friends that are ER docs, urologists, chiropractors, acupuncturists. And I will say that by and large, the pediatric chiropractic field, the people that specialize in family care and pediatric care and chiropractic, are some of the most generous professionals I've ever met in my life. They're, and I mean, to kind of put it into perspective, I think they kind of have to be passionate about what they do because everybody is coming against us.
Right.
There's a lot of pushback, and I think it goes back to that misconception. So advice I'd give parents, just general advice I'd give parents. I'll say it probably a couple times in this. Don't take yourself so seriously. And I say that because Sandy and I took ourselves way too seriously, and we added stress on ourselves and we added stress on our kids. I'm not saying that being a parent's not one of the most important and difficult things you'll ever do in your life. Not saying that at all. I'm just saying give yourself a lot of grace, because there's not really a playbook. You make the best decisions you can. Going back, that advice, or kind of how we live our life, make your plans and let God direct your steps. Like, have a
Mm-hmm.
game, move forward, but like, be flexible. Your kid's not going to be perfect in public. I guarantee you, they'll turn the escalator off. They'll hide in the clothes, in the clothing rack. They'll say some of the most awkward, inconvenient, rude comments to perfect strangers. And you just kind of have to roll with the punches and write that stuff down, because you will have a good laugh in 10 years with that.
100%. You are absolutely correct on that. I love that you brought that up because it's so true. So true. And I think that's why we kind of lighten up a little bit with each child, right? I mean, I only got to 2 and you're at 4. So I think you can probably really be a testament to that. Of each child, you get a little bit more relaxed, loose, a little bit more carefree. Not to say we don't, know how to rein it in if we need to, but
Right.
just in generally speaking, a little bit less stressed because we've already done it and have the experience.
Our number 1 frequently says about our number 4, I would have never got away with that.
Yes, exactly.
And we actually say to her, you're right, you wouldn't. But she was kind of our guinea pig. Like, she was,
Yeah, it
number
is.
one,
It's true.
number one's the game changer. You go from, like, for Sandy and I, it was Sandy and I, and then this baby that neither of us, I mean, Sandy and I were babies ourselves when we had our first. And so you just kind of go, I don't really know what I'm doing, but that's where, like, give yourself some grace, because you need it.
Yes, I have a mom friend that has 7 kids, so she will 100% back this conversation right now. Well, this whole just interview has been full of empowering nuggets. I tell you, I mean, I'm sitting here like, gosh, I got to get back to chiropractic consistently, and we haven't even been talking about adults. But is there any, I like to end with, what 3 tips would you give to our listeners to empower them? And, it can be in your field of expertise, or it can be just in general. It's, your choice.
Oh, man. 3 tips. Love God. That's number 1. Love your family and be intentional with others.
That's good. And I'm with you on the love God number 1, because this life is, you can't do it without him.
Right.
You can't do it. Well, Dr. Stein, where can people find you? Where can they get connected? If if they're local, obviously we want to hear about all that and where you're located. If they're not local, maybe they just want to go check out your social media and kind of know what to look for in a good pediatric chiropractor.
Yeah. So, we're pretty much straight ahead chiropractic everywhere. So we're straight ahead chiropractic on Facebook. We're straight ahead chiropractic on Instagram. We're straight ahead chiropractic on TikTok. We're straight ahead chiropractic.com on all of the interwebs. Yeah, we're pretty easy to find if you do the straight ahead chiropractic. Instagram's probably one of the easier places to find us. That's probably where we hang out the most from a social standpoint or social media standpoint. It's also where we produce a ton of content, that we don't just like put fluff in the captions either. Like, we actually will share a testimony, and then we'll break down, like, here's some of the neurophysiology behind that. This is how chiropractic works. So I really want to. I'm not the biggest fan of social media as a whole, which people are blown away by, because we've been fortunate enough to have a relatively good influence. Um, but I really feel like I'm on this kind of mission to utilize social media for good, and that's just to educate people, to overcome some of those misconceptions or misunderstandings. But I mean, You're gonna find a lot of cute kids there. You're gonna find a lot of education. You're gonna find some haters that are going to be there too. Um, and yeah, I think that we just all just try and have some good dialogue.
Hey, if you don't have haters, you're just not doing things right. So if you got haters, you're doing it right because you're speaking truth and just not everybody's going to agree with it. And that's okay.
Right.
But oh, I'm so glad that you came on. It has been such a enjoyable interview for me to really think about the power behind chiropractic. I mean, I think about when friends or family or people on social media like ask me, okay, what could I do? I've got this situation or that situation with them personally or their children. And I just think, chiropractic is just one of those foundational things that you just go out and do that first. Like go out, get your nervous system, your spinal cord aligned, like get everything back into place and hopefully in a place of more pushing towards homeostasis and that parasympathetic system. And I mean, it's just such a huge modality, important, powerful modality that we can utilize on top of all the other things out there, like we said, that you can put in the mix. But I really do see how it's so important. And like I said, I have myself seen the power of it with infants and with children. And then hearing your stories has been so encouraging. So thank you so much for being here and for educating us. And we'll have to have you back on again at some point in the future and dive into some things even deeper.
For sure. Yeah. Thanks for having me. Appreciate it.